Hi, welcome to Pearls, Procedural Education for Adaptation to Resource-Limited Settings, part of the Sugar curriculum. These modules are available online or on your phone and intended to help you prepare for work in resource-limited settings. We're all quite comfortable when we have the medical supplies we're used to, but take those away in resource-limited settings and things can get challenging. That's what this series is about. In this session, we'll learn how to improvise a spacer for a metered dose inhaler with or without a mask. The session will be led by Drs. Brenda Desai, Dr. Tina Slusher, and Dr. Mike Pitt on behalf of the Sugar Pearls investigators. Before we get started, a quick reminder. These sessions are not intended to teach detailed specifics of the medical management of conditions discussed, but rather to equip you with the ability to solve problems when you don't have the resources you're used to. Be sure to check out other resources online and in textbooks for more specific information. Now let's hand it over to Dr. Brenda Desai, who will go over the specifics of how to make this device.
For most patients with a condition like asthma, an inhaler is an important part of their prevention and treatment plan. A spacer should always be used with an inhaler. This will make sure that more of the medication reaches the lungs and your asthma is appropriately treated. The supplies you will be using to make your own spacer include a plastic bottle. This can be a water, sports drink, or saline bottle, scissors or scalpel, needle, and some tape. First, let's go over how to make a spacer without a mask. This would be especially useful for patients who are cooperative and able to wrap their mouth around the mouthpiece of the spacer. Step 1. With scissors or scalpel, cut a hole on the side of your plastic bottle to fit the mouth of your inhaler. Step 2. Insert the mouth of your inhaler into the hole you have just created. Step 3. Tape the area around the inhaler to secure the mouth of the inhaler to your newly created spacer. Make sure to use enough tape to create a good seal. Step 4. Take a needle, any gauge is fine, and create 2 holes on either side of the mouth of the bottle. This is to allow just enough air to escape the bottle during inhalation to prevent the bottle from collapsing. You now have a metered dose inhaler with a spacer that will allow patients to get the appropriate amount of medication into the lungs. Now, let's say you have a patient that is not able to use the spacer, for example, an infant or a patient who is uncooperative. In this case, we can use the same supplies as before to create a spacer with a mask. The first steps in creating a spacer with a mask are the same as before. Note that the MDI is already attached to our plastic bottle and a seal has been created. Next, you'll cut across the diameter of the bottle to create an opening that will fit over the mouth and nose of your patient. Next, tape the area you have just cut to smooth out the rough edges. Next, you'll need to make 2 vent holes, and this can be made about 1 to 2 centimeters from the opening of your mask. Now you have a spacer with a mask for infants or uncooperative patients. Remember, when you use the spacer, make sure to place the mask over the mouth and nose of your patient. Be sure to check out the full demonstration video for this skill at sugarprep.org. There you'll find links to other Sugar Pearls videos as well as access to the full Sugar curriculum.